This is Dr. Barron with Highpoint Spine and Joint Center, your Western Nebraska chiropractor, and I just wanted to talk a little bit today about tension headaches. Another term for them is a cervicogenic headache, meaning that it's a headache that generates because of the cervical spine. And so I want to talk a little bit about these headaches. They're very common. About 90% of people who have consistent headaches, it's related to a cervicogenic headache or a tension headache. And so it's very prevalent in our population. It sometimes can trigger migraines for people who are prone to migraines. When I talk about cervicogenic headaches, usually they stem from the cervical spine. Because of how the head sits on the cervical spine here, there's a lot of small muscular attachment that provide control for the head. And if there's something wrong or something restricted with the mechanics of the spine, that can then cause some tension up through the base of the skull and create these headaches. Classic of these headaches is that patients will come in with some sort of neck pain, some sort of neck stiffness, discomfort. Usually it'll be at the base of the skull, or at least a portion of it will be. They'll have some pain, some tenderness, and some tightness across the base of the skull. When they get bad, sometimes they create occipital neuralgia, where that nerve that supplies the sensation to the scalp will be irritated. And so they'll get kind of this pain that radiates up around the head and then sometimes can come in behind the eye. And so generally our treatment is aimed at focusing on the mechanics of the neck and the upper back to try and reduce tension and improve function of the spine so we can relax that part of the neck that is creating the headache. So generally we'll start by examining the head in all different planes of motion, rotation, along with lateral bend, and even some flexion and extension. And so we'll evaluate the spine in all three ranges of motion using motion palpation. Examine a lot of these muscles and their tonicity, how tight they are in the neck and in the upper back a little bit. So by evaluating the patient with this process, we can pinpoint what tissues are involved, and then that really helps us to focus our treatment. Oftentimes treatments consist of adjustments or spinal manipulation to free up segments in the spine that are restricted and that aren't moving properly, as well as dry needling, which is a soft tissue technique we use to try and relax certain muscles throughout the upper back and the neck. And then oftentimes we use some sort of a rehab or exercise protocol to try and give you certain exercises to help stretch out tight muscles and strengthen up deep muscles that may be weak, that can improve some stability. So hope that helps. If you have any questions, let us know. We'd be happy to help you at any time. Thanks.